Hi everyone, and welcome. I'm Dr. Chris Bano from Centreville Family Dentistry and Implant Center, and I appreciate you for taking a moment out of your evening to join me today for about 13 to 15 minutes. Some of you may have recently contacted our office because you're dealing with missing teeth, broken teeth, loose dentures, or teeth they've been told are no longer savable, or you're unhappy with your smile, or you're nervous about going to the dentist, just like so many other people, or you're unsure of where to begin, or you're looking for a dentist. Wherever you're starting, this presentation is for you. So over the next 15 minutes, I'm going to explain the different ways we can give you a new smile, who may be a candidate for dental implants, what happens when someone has bone loss, and what your first visit actually looks like with us. I also want to make something very clear at the very beginning. You do not need to know what treatment you need before you contact us. That's our job. And if you're not even looking for implants, this is a great segment to watch because I'm going to go over what our dental office is like and why you should come here. Okay? Before we begin, okay, let me know in the comments what brought you here tonight, whether you're looking to replace your teeth or you're just looking for a new dental office. Let me know, type something in the comments, and I'm going to be reading the chat as this segment goes on. Okay? Now, I'm sure that we have a mixture of answers, and that is exactly why there is no single treatment that is right for every patient. We as dentists have to treat everyone uniquely based on their unique situation. Let's begin with the first question we ask every patient at our dental office. Can your natural teeth be saved? Dental implants are an incredible option, but our goal is not to give every patient implants. Our goal is to determine the most predictable, healthy, and appropriate treatment for you. In some cases, a damaged tooth can still be saved with a filling, a crown, or root canal, maybe gum treatment or bite correction. In other cases, the teeth may be healthy, but the patient wants to improve the appearance of their smile, whether it's whitening, veneers, or like clear aligners, braces. And then there are situations where one or tooth, several teeth, or entire arch of teeth can no longer be fixed. And that is when we begin discussing replacement options, such as bridges, implant-supported teeth, or even individual implants. And the great thing about our practice is there's 4 of us, 4 dentists, each with a separate field of expertise and a passion, which allows us to see every single patient. The important point is the treatment should begin with a proper diagnosis and not with a product. Again, you're unique. We need to understand you, the condition of your teeth, your gums, your bone, your bite, your jaw joints, overall health. We also need to understand what you want. Some people want the most fixed and natural solution possible. Some are ready to complete treatment immediately, while others, they just want to process it longer. All of these conversations are valid. Also, for anyone that may have joined us a few minutes late, we are discussing the different ways that we can restore missing, damaged, or failing teeth. We're also going to talk about dental implants, bone loss, comfort, cost concerns, and exactly what happens during a consultation that you come in and see us. Okay? Now, let's talk specifically about dental implants. A dental implant is designed to replace the root portion of a tooth. Once the implant has integrated with a bone, it can support a tooth, a bridge, or multiple teeth. And there are 3 broad categories that most patients should understand. The first is a single tooth option. This is commonly used when one tooth is missing or cannot be saved, and the implant supports a single individual tooth without relying on the neighboring teeth. The second option is an implant-supported bridge. This is where you use 2 or more implants to support 3 or more teeth, all connected together. And the third option is a full arch solution, basically an implant bridge that spans the entire mouth. And this is appropriate for someone that's missing a lot of teeth, all of their teeth, or they need all their teeth pulled out. The nice thing about this option is that we can give you a full set of temporary teeth the same day. Okay? Now, not every patient needs full mouth dental implants. In fact, I want you to type myth or fact in the comments, okay? So, let's get started. Everyone with missing teeth needs a full set of dental implants. That is a myth. One patient may need a single implant, another may benefit from a bridge, and another may be better served with a full arch fixed implant option. Some patients, they may still have teeth that can be saved. The correct recommendation depends on the condition of your mouth and your goals. This is also why we are so cautious about giving exact recommendations over the phone, right? When we haven't even seen you. A paragraph or a photograph or a short description, it can't replace us physically seeing you in person in a 3D scan that goes around your head. And one concern that we frequently hear is, I've already been told that I don't have enough bone for dental implants. Can you just let me know? Look, bone is important because dental implants need a stable foundation. After teeth are removed, the surrounding bone can gradually shrink, and I'm sure you know that. Gum disease, infection, long-term denture use, smoking, diabetes, certain health conditions, and previous dental treatment can also affect available bone. However, bone loss does not automatically mean that treatment is not possible. Some patients may be candidates for bone grafting. Others may have usable bone in other areas that weren't evaluated before. In some situations, a different number, size, or position of implants is also considered. And the only responsible way to answer that question is we need to evaluate you in person with our own 3D scan. Another common question is whether dental implant treatment hurts. It's completely normal to be nervous about dental implant treatment, especially if you've had difficult experiences in the past with dentists. During treatment, we use oral sedation and, of course, local anesthetics, so you don't feel anything. The more comfortable you are, the better we work. So, of course, our goal is your comfort. And most patients tell us that anticipation was much, much worse than the actual procedure or what happens after. That does not mean that there's never soreness afterwards. Dental surgery is still surgery. However, we plan carefully, we provide detailed instructions, medications, and follow patients throughout the entire healing process. Okay? Now, some people may be watching that are not afraid of the procedure itself, but you may be more afraid of being judged. You may have avoided the dentist for 5 years, 10 years, or even longer, and you may be embarrassed by broken teeth, bad breath, infection, or even the appearance of your smile. You may feel that you should have addressed it sooner, right? But please understand, our role is not to lecture you about what happened in the past. We see patients every single week who have delayed treatment because of fear, finances, family responsibilities, health problems, or just a previous negative experience with the dentist. We are focused on understanding where you are now and helping you decide where you would like to go in the future from here. There's no benefit in making someone feel worse about a problem they already know exists. Now I want you to take a moment to type in your biggest concern in the comments, whether it's pain, cost, treatment time, embarrassment, or even uncertainty. Just please type that in and let me know in the comments. Now, this is usually the point where we begin seeing many questions about cost. What is the cost of dental treatment, dental implants? Dental treatment can be a major investment, especially when someone needs extensive care like implants. The cost of replacing one tooth is different from a bridge and is different from a full arch of teeth. Some patients require bone grafting, some need additional procedures, while others do not need any of that. However, what I can tell you is this: during your first consultation with us, we determine the appropriate treatment options. Once we know what is clinically possible, we can discuss the estimated costs, timing, possible phases, and available financial options that you have available to you. But if you're in dentures or you 100% know that you need your teeth to come out and you're looking for an investment for full arch implants, it ranges between $14,500 to $19,000 per arch at our office. And that includes everything. We discuss everything in person and in more detail. However, like I said in the beginning, our goal is not to assume that every patient needs the largest or more expensive treatment. Our goal is to show you the best options for your mouth and your health and help you understand the advantages, help you understand the limitations, and the expectations of every single option that you have available to you. At Centreville Family Dentistry and Implant Center, we have built our practice around comprehensive care. That means we do so much more than place dental implants. Like I said, there's 4 of us, 4 doctors in this office, including myself. We provide preventative care, restorative dentistry, pediatric kids, growth dentistry, TMJ, TMD, sleep apnea options, cosmetic dentistry, emergency care, treatment for damaged or missing teeth, wisdom teeth removal, advanced implant procedures, all of it. Having multiple doctors and a broad range of services allows us to offer so much more, and we get to see everything from a broader lens. We use digital photography, digital scanning, 3D imaging to help us plan and see exactly what we need to see. And I believe patients make better decisions when they can actually see and understand the problem at hand. You should not feel pressured into making a decision. You should feel like you understand what needs to be done, okay? Another important difference is continuity. With complex dental care, patients sometimes feel as though they are being sent from office to office without anyone overseeing the complete plan. Whenever possible, we try to coordinate everything in-house without any referrals, and we pay close attention to the final result. An implant can be successful, but the teeth still need to look, function properly, feel comfortably, and you need to like the teeth in your mouth. Okay? And the goal is not to simply just place implants or do surgery. The goal is to help someone become healthy, functional, and proud to smile. Now, I would like to address another question that we hear frequently. What happens if I come in for a consultation and I'm not ready to start? The answer is simple. You don't have to begin treatment that day. A consultation is designed to give you clarity, is designed to make sure you like us and trust us, and it allows us to identify what is happening in your mouth, explain what may be possible for you, and answer your questions. Your first visit is typically going to begin with a conversation about your concerns. We want to know what is bothering you, what you would like to change, and whether you're experiencing pain, and whether you have had any difficult dental experiences in the past. We then gather the necessary records, depending on your needs. That may include photographs, x-rays, 3D scans. And then after examining everything, your bone, teeth, bite, everything, we review it all with you. In simple cases, the treatment is straightforward. In complex cases, we may need additional planning before presenting everything to you. Either way, you should leave with a better understanding of your condition and the next appropriate step. Now, let's do one final question together. On the scale of 1 to 5, how ready are you to address your smile or your mouth? 1 means you're only beginning to research. 5 means you are ready to schedule a consultation with us. Type the number in the comments, and I'm going to be reading them. Now, whether you're at a 1 or a 5, you're still welcome to speaking with us. You do not have to have everything figured out. You do not need to be at a 5. You do not need to know whether you need an implant, a crown, denture, veneers, or something completely different. You also do not need to have to commit to major dental procedures simply because you ask us for information. But I would encourage you to not ignore your dental health. Broken teeth can continue to break down. Infections worsen, gum disease worsens. Remaining teeth can shift around, and all these are more expensive down the line, especially if you wait years. Getting an evaluation with us does not obligate you to start treatment, but it allows you to make decisions based on the information that we give you. So, if you're interested in exploring your options or finding the best course of treatment for yourself, or if you'd like to speak to someone from our team one-on-one, then just give us a call at 269-467-9325. We're open Monday through Wednesday 8 to 5, Thursday 8 to 1, or click on the description, submit your contact details, and we'll give you a call as soon as possible. And to anyone who left a comment in the chat, I'm going to be personally reviewing every single one of them. Thank you again for spending part of your evening with me. I know it can be difficult to take that first step, especially if you've been living with dental problems for a long time and committing to coming to another dentist. But no matter how long it has been, the conversation can begin without judgment, without pressure. You do not need to solve everything tonight. I'm Dr. Chris Bano from Centreville Family Dentistry and Implant Center, and we look forward to meeting you. We look forward to learning more about what you would like to change and helping you understand what may be possible for your smile. Have a great evening, everyone, and we hope to see you very soon.